Can't quite get Dr.
Yes.
Dr. I've lost your audio.
Can you hear me?
Now that's much better. Yes. What is the purpose of family planning?
Family planning's main aim is to achieve pregnancy when it is desired, and to prevent an unwanted or an unintended pregnancy. So just by the way we use the term loosely, family planning is to make sure that someone falls or conceives when they desire to do so.
99%, so to speak, not 100%. So I have seen women who've gotten pregnant, after they have, these family planning methods, or they have picked one. What really informs this?
Yes, well, not all family planning methods that are available are not 100% effective.
Yeah.
Because these are things that are these are man-made things. And I don't think there's anything man-made on this earth that is 100% effective. However, there are some that are considered more effective than others. So some family planning methods would achieve pregnancy prevention better than others. So yes, women might fall pregnant on a family planning method. However, there are systems or there are choices that you can make to reduce the chance of that happening.
And in this case then, if a person conceives at a time when they have a family planning method on, will this have any impact or effect on the baby that has been conceived, fetus?
The answer to that question is yes and no.
Okay.
It depends on what family planning method they were using as they fell pregnant. For example, if a woman falls pregnant while she was using the contraceptive pill, usually there's no side effect. But however, if a woman falls pregnant and she is using, for example, the family planning methods that are put in the womb, we call them the intrauterine device, then she has a slightly higher increase of having an abnormal pregnancy. Example, the pregnancy growing in the wrong place. We call that an ectopic pregnancy.
Well, yes. All right, we get to learn some more about that. But first of all, first things first, family planning methods, now that you mentioned that there are methods that, the intra ones, the uterine ones, and, there are also different ones. For the benefit of the person who would not be privy to this information, what are some of the methods that we have?
Okay. The common methods
as you classify them maybe in groups.
Yes, yes, okay. So I can classify them into some broad categories.
Right.
I can start with the oral methods, the ones that you take by mouth every day.
Yeah.
Those ones, there are two main types. We have what we call the combined oral contraceptives. Now that consists of two different hormones which are normally produced in a woman's own body. If I can mention those names, it's estrogen and progesterone. Okay. Then there's another type of oral contraceptive which only contains one hormone.
Yeah.
And we call that the mini pill. So most times people will know of the combined contraceptive and the mini pill. Those would be the oral contraceptives. Then there are other types of contraceptives. Most would be in the category of, for example, the injectable contraceptives.
Yeah.
Then we also have the implantable ones. So that is put inside the body. Now, under that category, we have the subdermal, means you put it under the skin. And then we also have the intrauterine contraception, which means it is put in the womb. Okay?
Yeah.
Another type of contraceptive we have is the emergency contraceptive. The one that probably, remember, most of these contraceptives, someone is taking before the possibility of them falling pregnant.
Right.
But sometimes you can look for contraceptive after the chance of you falling pregnant has happened. So, for example, we call that the morning after, usually in loose terminology. But the proper word is emergency contraception. So you're using it after the fact. Okay?
Yeah.
And there are various types of those emergency contraception. And of course, we also have the barrier contraceptives, and these now include condoms, the male condom, also the female condom, and then we also have things like cervical caps and diaphragms, which now form a barrier and prevent the egg to be fertilized. Yes.
There's one that is put on the hand. Which one? Where does it fall?
The one that is put on the hand is usually put on the arm, isn't it? And that one, we call it the implantable, an implant. So it's an implantable contraceptive method.
It's a category on its own?
Yes, it's a category of its own. Because if you think about the implant, it is put under the skin. And then we also have the other one that I'd mentioned, the intrauterine devices, which are also put into the body, but now it is put in the womb.
Right.
So one type can be put under the skin, we call that the implant. The other type can be put into the woman's womb. So those would be implantable contraceptives.
Before we even get to at what age one should start using contraceptives or one should start using family planning, then the question would be, in regards to these categories that you've taken us through, which would be the best category, or does it differ based on an individual?
Yes, we say that one size does not fit all. Okay? So what may be best for one lady might not be the best for the next lady. So to choose the best contraceptive method for a particular person, physicians or doctors would want to know more about this person. If they have any other conditions, for example, if they have high blood pressure, if they have other medical conditions like diabetes, and then based on a person's medical status, you will find that the best type of contraception will vary. Also based on their age, also based on their body size. So the short answer to that question is that the best contraception will depend on the circumstances of the person who's using the contraception.
All right. Before we even finish, there's someone asking a question here. Says, where then does the likes of vasectomy and all this for family planning methods for men fall?
Okay. So the ones I had mentioned before, those are reversible contraceptives. So everything we've discussed up to this point is a reversible form of contraceptive. That means when you stop using it, then you have the ability to conceive once again. However, we also have what we call permanent methods. Now, we usually will not say that is contraception, we will say that is sterilization. And sterilization means it's a permanent form of preventing the chance of falling pregnant. And for men, that includes vasectomy. And for women, it includes what we call tubal ligation. So the fallopian tubes get sealed, and that will be a permanent way. So it's not something you can usually do, but it's also a form of preventing pregnancy.
Freezing eggs. Expand more on that.
Freezing eggs is a new method nowadays that has become available to women. And the whole concept of freezing eggs is to say a woman maybe is not ready to conceive or get a baby at a certain point in her life. And we know medically that as women grow older, the quality of their eggs starts to decline. So what has happened nowadays that is available is that when a woman is still relatively young, she can have her eggs harvested or removed from her body. Some eggs, not all of them, just a number, a few of them. And then those can be frozen commercially for her to use at a later date. And the thinking is that whenever she's ready to fall pregnant in the future, instead of her falling pregnant with the eggs that she currently has that will be the same age as her, she can use the so-called frozen eggs, which will be kept relatively at the state they were when they were harvested.
Right.
The thinking is...
All right. Well, I know there's so much that we'd want to pick on just understanding the methods that are available, but then that would block us from addressing other key issues, within the presence of time. So let's pick a different look on this. And we've talked about the methods. We've seen what is available. Then one would want to ask themselves that, well, apart from the fact that yes, you can prevent yourself from getting pregnant, what are some of these positive beats of having family planning or getting up a family planning method? Because this is getting common by the day. Sometimes you get to hospital and even before you call for this or ask for this, you are advised to take that direction. So before we get to the side effects, what are the good effects of this?
Okay, good. It's a good question that you've asked. Now, contraceptive, its main purpose is to prevent pregnancy. However, we have what we call the non-contraceptive benefits of using contraception. Commonly here we are referring to probably the oral contraceptive pill, the combined pill, the common one that people use every day. Some of the benefits of contraception, aside from preventing pregnancy, can be correction of acne, for example. So there are some women, some ladies who, suffer with acne breakouts, and it has been seen that the hormones, remember we said the combined pill contains hormones, those hormones can help regulate the skin texture, improve acne. It has also been shown to improve, for example, some ladies might have excessive growth on their hair or hair on their face. We call that hirsutism. Contraceptives can help to control that as well.
Well, that's amazing.
Another thing that contraceptives are good at helping, for example, another thing they help in regulating, especially the ladies who have very heavy periods. Okay? So for women who have heavy cycles, and sometimes this can even cause a condition known as anemia, where you have low blood levels in your body. Usually the contraceptives will reduce the amount of bleeding and also help to correct conditions like anemia that someone may have. So we recommend it for women who have problematic heavy bleeding. Contraceptives can also benefit those ladies or women who have painful periods. So you find that sometimes every month someone is, for example, bedridden or very uncomfortable due to pain that comes with the period. Now, contraceptives can help with reducing that pain. So we've prescribed them commonly to help that. And lastly, the benefits are many, but we'll just try and summarize them. It has also been shown that you can reduce the risk of cancer, some type of cancers, this contraceptive, specifically cancer of the womb, and cancer of ovaries, which are common cancers in women. You hear people saying they have cancer of the ovaries, which is now where the eggs are stored, or they develop cancer of the womb. So using these contraceptives can reduce the chances of getting those type of cancers.
Well, that's amazing. Now let's cross over to the side effects of it. I think most of the people should be celebrating by now, listening to all these great effects that family planning methods can bring. But equally, a fair share of negatives, and in most cases, people have argued actually, or this is the picture that has been painted out here, that the benefits are by far outweighed by the negatives.
Well, that is not 100% correct to say that the negatives are more than the benefits. Remember, we've said that every woman should be assessed individually because, yes, there are side effects to some forms of contraception. So generally, let's mention them. One common side effect is especially, and this will depend on the type of contraceptive being used. Okay? So if we start with the oral contraceptives, a side effect they can have is they can increase the risk of developing a blood clot, which is a very serious side effect.
Right.
Okay? So we usually avoid giving that type of contraceptive to women who we know have a high risk of getting blood clot. So that means older women, women who smoke, women who have other medical conditions. We usually do not want to give them that type of contraceptive because we don't want them to get blood clots. So that's a serious one, which can be fatal sometimes. Other side effects that are there is sometimes it can also cause, depending on the form of contraceptive one is using, it can disturb their cycle. We said that one of the benefits is to reduce someone's heavy periods, but also on the flip side, some contraceptives can alter a woman's cycle, and she can have what we call irregular bleeding or spotting. So some women will find that very bothersome, depending on the type of contraceptive they are using. Other times we've had that contraceptives, maybe like the injectable one, the 3-month injectable contraception, might cause someone to have increased body weight. So there's weight gain, and some people may not want that. So they view it negatively. And sometimes also contraceptions may alter someone's general mood and psyche. So you find it increases mood swings or irritability.
Which ends at some point, or cuts across all the duration that you have put there, because some of the people who have these contraceptive methods for years.
Most of the time, these side effects happen at the onset of using that method. And that is the most important time, because when you've just started using it, if you experience those side effects, most people now abandon that method of contraception. But it's a good question you've asked, because the side effects do not last commonly throughout the duration of use. Most of them happen at the onset. And if people are able to persevere through the early stages, usually you find that the body adapts and those side effects tend to fade away. So most of the side effects I've mentioned are the ones that you would find commonly happen at the onset of using that method.
So at what point then should one realize that there is need to probably change the method, and maybe this method is not working? Because then I would want to believe that will be instigated with the kind of side effects. So should we give it time, or almost instantly when it is not working well, you lose and probably try a different one?
What we recommend is to give it at least a couple of months. Because if you abandon it immediately, you might find that the next one you use will give you also a side effect which you'll also abandon immediately, and you'll find that maybe none is appropriate for yourself. So we advise that as long as the side effect is not a serious one, like we said, remember the risk of developing a clot.
Yeah.
That one we do not take chances with. So we would not even put somebody on that contraception to begin with.
Okay.
But the other ones that I've mentioned, usually like irregular spotting or some mood swings here and there, we usually say give it a couple of months, 2 months or so, and if you feel that 2 months later you're not tolerating these side effects very well, then you can consider using an alternative.
So let's speak about
Yes.
the durations again. For how long can one have it? And can you say have it for about 5 years and immediately lose this one and get another one and have another duration like for 5 years or 10 years? And what would be the effects of the same?
Okay. Now, that's a good question. We can divide contraceptives broadly into
Equip Africa College
what we call
is a Tibet institution
long-acting
accredited by the Ministry of
contraceptives.
Education and relevant professional
Long-acting
regulatory
and
bodies.
short-acting.
The college
The
located in
short-acting
Kitale
ones
is
are,
a
for
center
example,
of
the
excellence
pill
in health.
that someone would take every day. That means if you stop taking it today, by tomorrow the effectivity has almost gone.
Yeah.
Okay? So those ones are only effective as long as you are taking them. And usually you can take for as long as you want.
Yeah.
Then we have the long-acting ones. For example, the intrauterine device or the implant that is put in the womb. We have two types. One that is based on copper, which can last up to 10 years. Okay?
Yeah.
And like you say, if someone wants to renew it at the expiry of the duration, you can insert another one immediately.
Doctor, allow me
The
to cut
other-
your line of thought. Just briefly, we'll come back to that. Let's pick this phone call. Good morning.
Yes. Okay.
Hello.
Hello,
Good morning. How are you?
I'm fine.
Welcome to the discussion. What do you have to say?
I was just asking about the planning.
Sorry?
Eh? I'm fine. I was just asking about from that method of family planning emergency contraceptive. Nauliza swali. Eh?
Yes, I'm trying to get you very well. I don't know whether Daktari has been able to hear that.
Yes.
I think
Can we
I
ask-
could hear something about agency.
Can you ask the question again, please?
Nauliza.
Nakusikia?
Nauliza. Hello.
Nakusikia, endelea.
Nasema kwa hizo method za family planning nilikuwa na swali kwa hizo emergency contraceptive.
Okay.
Uliza, daktari anakusikia.
Kwa hiyo method emergency contraceptive za family
Au swali lako ni gani? To hold, it wasn't very clear, but it's something to do with planning or pills. So I hope she would call back. And yes, Daktari, let's go back to where we left it.
Okay. I'll assume that what she was asking, maybe she might be able to call back and ask the question again.
Yeah.
But it's a common thing that people would want to know.
Yeah.
The emergency family planning. What is the time limit within which you can use it, for
All right.
example?
Yeah.
So we usually say it is most effective 24 hours after the incident. Okay?
Yeah.
Most of them can be used up to 3 days. Then they're relatively effective up to 3 days after. But with every passing day, the effectiveness of the emergency contraception reduces. So it is most effective 24 hours later.
Yeah.
However, you can use it up to 3 days after, especially for this, what we call the P2 or the morning after, the common one that is sold in the pharmacies without a prescription.
We have another
However,
phone
there
call
are
from
other
Meru.
methods.
Just briefly, Dr. because yes, people have lots of questions. Good morning.
Morning to you.
Okay.
Yes, sir.
I would like to know at what age can a woman start using that contraceptives or an injection?
All right, thank you. And I think, Dr. this also my question, at what point then? Because nowadays we see mommies introducing their kids to that because there's that fear, oh, she's going to get pregnant. So we need to protect us as early as possible from that caller. So yes, I think we'll go step by step.
Okay. Now, contraception should be introduced as long as there's a risk of falling pregnant and someone does not want to fall pregnant. Okay? So, like you said, some mothers would want to their daughters to be on contraception.
Yeah.
Now, this has to be looked at in context. In context, because we also know that some forms of sexual activity are not legal in this country. So you need to look at the circumstances of the situation,
Yeah.
and then you can make an assessment. Is this person who is, for example, underage, below 18, are they in a legally accepted form of relationship, or is it an illegal form?
But what
that
are
is
the
a legal
ultimate
matter.
effects, Dr. And I'll ask this for the sake of all the girls out there. Some of them would want the same because, well, truth is that they are actively involved or they are active on matters intercourse, and we cannot overlook that. But also there's that fear. I don't know whether it's true or it's a myth, that, you know, there are long-term effects to that, you know, when you take after pills for a long time, or when you take these general pills for a long time, or when you have implant, you know, and by the time you're getting to that point where you want to get babies, you're not able to get babies. Or if you have to get babies, then it will take a while. Some of them will come, some of them will be born with, you know, defects and, you know, all this.
Yes. Well, like you said, it is a common conception that exists out there in the public. I would want to dispel a lot of those ideas, okay? Those, we call them misconceptions. So, if you use contraception at an early age, in your adolescent years, or even in adulthood, it does not have any long-term side effects to you and your reproductive ability later on. The
This
contraceptive per se.
We have very many calls, Dr. And we've picked another question still in relation to that. Should this answer this question that there's a lady who says she's been on injectables for a while, then she stopped, and for a long time she's not been able to get her periods. One, are there likelihoods that she's going to get another baby in the event that she wants one? And for how long would that take? And would it have an effect in any way?
The injectable contraception, the 3-monthly injectable contraception, it has been shown that after use of that method for a prolonged period of time, usually more than 2 years continuously, there is a risk of delayed return to fertility. What does that mean? It means if you've been using the injectable contraception for a number of years and you stop it, you might not be able to fall pregnant the day you stop using that injection. It might take a month or two, or sometimes longer, to fall pregnant. And we call that delay of return to fertility. It's not permanent. So it's not that now you can never fall pregnant again. There's a slight delay, especially for the 3-month injection contraception. It does not seem to be the same with other methods. So other methods, as soon as you stop them, you fall pregnant soon afterwards. But the 3-month injection, might have that delay.
Well answered right there. There is another gentleman who's asking, like he's had an experience with a wife who had, 3 months contraceptive or 3 months family planning, and looks like the lady lost sexual desire. Could there be a possibility that this could bring such an effect? And also she started experiencing painful periods. What would you tell this gentleman?
That is something that we have experienced, that some forms of contraception, if we can recap what we had said, they can cause some mood changes. Some can, especially the ones that contain progesterone. So that would be like the 3-month injection or the mini pill, what we call the mini pill, which is the type of pill that you take every day but only has one hormone. So those two types that we've mentioned sometimes tend to reduce a woman's libido, that is her sexual desire, for some women, not all women. And that might cause maybe family or difficulties between two partners, because if the libido is reduced, someone may not want to initiate intimacy, and that is one of the side effects, yes, that can happen with this method. With those two methods.
There are lots of questions coming on board. I think this will be the last one we'll pick in the interest of time. Then we'll allow you to give your number so all these people can contact and get information from you. So there's a mother who is asking, her 22-year-old has been on Peroxica or has been using Peroxica. She would want to know whether this has got any side effects or what could be the long-term side effects, if any, or if it's a good method.
Oh, the girl is 22 years old. Okay.
Yes.
So if there are no, what we would say is that there are no long-term, as long as she does not have current side effects right now. When she stops using this method, she should not expect to have any long-lasting side effects. So if it is working for her, she should continue using it, and she should not be too much concerned about what will happen after she stops using it.
Dr. Arian, I think I'll shelve my own questions, including that one of, for breastfeeding moms. Immediately you are introduced to family planning, of what effect that would be, or whether it's going to help, or whether it's going to alter again the production of milk, and so much so. So as you answer that, please give us your number so that we'll have people calling you. And I'm hoping that we can have this session some other time.
Okay, well, that's fine. For women women who've just given birth, a lot of them are very interested in using a form of contraception so that they're able to have enough time to raise the child that they have just delivered. With that said, there are types of contraception that are not good to use immediately after delivering. And those are, like, let's say, the combined oral contraception. Any contraceptive method that has the hormone estrogen will not be good immediately after birth, because we've shown that reduces the quality and the amount of breast milk. So after delivery, a woman should stick either to a non-hormonal method of contraception, or if it is hormonal, it should only contain the one hormone, which we call progesterone, which can be used after delivery. So that would include the mini pill, like we had mentioned earlier, and also the 3-month injection. Those only contain one hormone, and they are safe for breastfeeding, and to avoid any contraceptive method that has estrogen, because that will reduce milk supply and also the milk quality for the newborn infant.
Thank you so much, Dr. I'll be unfair to you and fair to myself because then due to public demand, we are supposed to have this session again. So I'll make it easy for you to come over again, and I'll tell the viewer to take advantage of the numbers that are running down on your screen, especially the SMS short code that is 22047 and hashtag Morning Cafe at Linda_Alela TV47KE. Drop those comments or the questions that you have for Daktari, and then I'll put them in order and a purpose to have Daktari again. Who knows, even tomorrow, if at all, he's going to give us that leeway, and then we get to have this session as you ask all these questions. And later on, we'll also be running his numbers down on the screen so you can extensively consult on that very note. Because of the interest of time, Daktari might not be able to expound some more on the same, but we have to say thank you so much this morning for the great insights and for the numerous feedback from the viewer. Dr. George Mukaya, gynecologist, thank you so much. We get to see you again at some other time, and equally for the viewer, we meet again tomorrow. My name is Linda Alela. That's where we get to wind up Morning Cafe.